Traveller's diarrhea is the most common illness amongst travelers. Each year, between 20 to 50% of international travelers, an estimated 10 million persons, develop diarrhea. Traveller's diarrhea usually occurs within the first week of travel, but may occur at any time when traveling. High-risk destinations include the developing countries of Latin America, Africa, the Middle East, and Asia. Intermediate risk countries include Southern Europe and a few Caribbean islands. Persons at higher risk include adults who are immunosuppressed, persons with inflammatory bowel disease or diabetes, and persons taking H2 blockers or antacids. The primary source of infection is the ingestion of fecally contaminated food or water. Bacterial diarrhea has an abrupt onset. Typically, the traveler experiences 3 or more loose or watery stools per day. Other associated symptoms include nausea, vomiting, abdominal cramping, bloating, fever, urgency, and malaise. Most cases are benign and resolve in 1 to 2 days without treatment. Traveler's diarrhea is rarely life-threatening. 90% of cases resolve within 1 week. 98% resolve within the month. Bacterial enteropathogens cause approximately 80% of traveler's diarrhea cases. Other causative agents include viruses and parasitic enteric pathogens. Travelers can minimize their risk by practicing the following effective preventive measures. Do not eat foods or drinks purchased from street vendors or other establishments where unhygienic conditions may be present. Avoid eating raw or undercooked meat and seafood. Avoid raw fruits, nuts, and vegetables unless the traveler peels them him or herself. Avoid tap water, ice, unpasteurized milk, and dairy products. Though tempting, do avoid frozen desserts. Avoid buffet foods, especially if there are no covers or fly controls. Avoid eating large carnivorous fish, especially from reef areas such as red snapper, sea bass, grouper, and barracuda. Avoid creamy food and desserts such as custards or sauces, such as mayonnaise, salad dressing, chutneys, or sauces. Do not use tap water to brush your teeth. Now let's discuss what is more likely to be safe. Steaming, well-cooked, and packaged foods are usually safe. Seek establishments that cater to travelers and that are known by other travelers as safe. Breads, tortillas, crackers, biscuits, and other baked goods are usually safe. Select fruits, nuts, and vegetables with thick skins, peels, or shells, and remove them yourself. Remember that you should always wash your hands with soap before eating and after using the toilet. Safe beverages include bottled water with an unbroken seal. Remember to use bottled water when brushing your teeth. Beverages made with boiled water are safer, such as hot tea or coffee. Drink international brand beverages in sealed containers. You may purify water yourself by boiling it for at least 1 minute. The other method involves using a combination of filtering plus 2% iodine treatment. Make certain that you have a good quality filter with a pore size of at least 0.2 microns. Add 5 drops of 2% iodine to 1 liter of water. Let it stand for 30 minutes. Subsequently, add about 50 milligrams of vitamin C and shake briefly. This will eliminate the iodine taste and odor. If you have thyroid problems, are pregnant, or have an iodine allergy, the alternative is using tetraglycine hydroperiodide tablets such as the brand Portable Aqua. When it comes to prophylaxis, the CDC does not recommend antimicrobial drugs, such as antibiotics, to prevent travelers' diarrhea. Antimicrobials can increase a traveler's susceptibility to resistant bacterial pathogens. As a result, the traveler is given a false sense of security. An effective prophylactic is the use of bismuth subthiosulate. The recommended frequency and dose is either 2 tablets taken 4 times daily or 2 fluid ounces taken 4 times daily. The mechanism of action appears to be both antibacterial and antisecretory. Potential side effects of bismuth subthiosulate include temporary blackening of the stool and tongue and ringing of the ears. Prophylactic bismuth subthiosulate should not be used beyond 3 weeks. Of note, bismuth subthiosulate can prevent the absorption of doxycycline, so the two should not be taken within the same hour. Do note it is not approved for the use of children under the age of 3, and it is never to be given to children or adolescents with viral infections, such as chickenpox or influenza. Another safe prophylactic measure includes taking probiotics such as lactobacillus. It is well tolerated and side effects are extremely rare. Traveler's diarrhea is a self-limited disorder that often resolves without treatment. Oral rehydration may be a benefit to replace lost fluids and electrolytes. Oral rehydration solutions are available at most pharmacy stores. Reconstitute it in treated or bottled water and discard any leftover solution after 24 hours. Travelers who develop 3 or more loose stools in an 8-hour period, especially when associated with nausea, vomiting, abdominal cramps, fever, or blood in the stools, may best benefit from antimicrobial therapy. Fluoroquinolones or azithromycin are the drugs of choice. Azithromycin is safe during pregnancy and for those under the age of 18. In addition to prophylaxis, bismuth subsalicylate may be used as treatment. If diarrhea persists despite therapy, the traveler should be evaluated by a physician and treated for a possible parasitic infection. Antimotility drugs such as loperamide reduce diarrhea by slowing the transit time in the gut, thus allowing more time for absorption. These agents should not be used by travelers with fever or bloody diarrhea because they can increase the severity of disease by delaying the clearance of causative organisms. When recovering from diarrhea, do not force yourself to eat. If you're not hungry, drink lots of fluids instead. When you are peckish, you can eat, but you should avoid non-intestinal irritants such as alcohol, coffee, strong tea, spicy foods, and greasy foods. On dairy, you should start with mild foods such as bananas, boiled rice, dried toast, or chicken soup. Let us review. For mild diarrhea, use bismuth subsalicylate or an antimotility drug such as loperamide for a maximum of 24 hours. For moderate diarrhea, you may use your prescribed antibiotic, and you may add an antimotility drug such as loperamide for a more rapid effect. For severe diarrhea, use a prescribed antibiotic and do not use antimotility drugs. Pay attention to rehydration and seek medical attention should symptoms not rapidly improve. Each year, between 20% to 50% of international travelers, an estimated 10 million persons, develop diarrhea. A consultation with a travel medicine physician will put the odds in your favor. A travel medicine physician will prescribe the vaccines and medications that are the best fit for your health and your travel destination. Bon voyage and safe travels.